Bismillahirrahmanirrahim. Continued with the CME tip with the name of Allah. Bismillahirrahmanirrahim. I start with the CME with the name of Allah, who is very, very kind, helpful and merciful. CME update by Mother and Child Survival Group of Pakistan. Me, Dr. Tariq of the Gynae Family Emergency Specialist, internist Gulf KSA, now district gynecologist. Continued CME of ambiguous genitalia, baby delivered with ambiguous genitalia. This case has to be handled sympathetically, and the patient need to be counseled that this is not a baby. Otherwise, the baby is healthy, but it has got some deficiency of. But there is some modification or of external genitalia. It needs to be investigated and it has to be sorted out. And the name of the sex of the baby will be assigned later when all these investigations will be completed. It's maybe due to some chromosomal disorder, karyotyping, or due to endocrine disorder. So, and there's no need for ultrasound now as there is no structural malformation is there. There is ambiguous genitalia, and it is due to either endocrine or due to some chromosomal disorders. So, and the important thing is to sort it out. The immediate life-threatening condition there's like congenital adrenal hyperplasia. The rest of are the true female pseudohermaphroditism, male pseudohermaphroditism, and male pseudohermaphroditism, true hermaphroditism, and gonadal dysgenesis. We have to see that the gonads are palpable, and then likely to be, if not palpable, then likely to be a girl. And then we have to find out the phallus length, diameter, position of the urinary meatus, and the labioscotal folds. And we have to see the vaginal pouch, and the urogenital sinus. We have to see the ultrasound and MRI to see the internal gonads. Later, the laparoscopic biopsy of the gonads and the laparoscopic gonadectomy later in selected cases. And the investigations are androgens, 17-hydroxy progesterone, and 11-deoxycortisol, and androgens and serum electrolytes, and testosterone. And then is the management is according to the investigations and diagnosis and the parents' wishes. And the immediate treatment is the congenital adrenal hyperplasia and correction of the serum electrolytes, and the cortisol for suppression of the endocrine deoxycorticosterone. This is the commonest, satrahydroxyprogesterone is the commonest sexual ambiguity due to the enzyme satrahydroxyprogesterone, which converts satrahydroxyprogesterone to satrahydroxyprogesterone to deoxyprogesterone and deoxycorticosterone and deoxycortisol. These are there is true hermaphroditism or hermaphroditism. The other test needs to be testosterone, androgen, serum electrolytes, DHEA, DHEAS, and there are three. This is with the androgen excess, while the other forms which are with the three forms are discovered which are having the androgen, absence of excess androgens. These are satrahydroxyprogesterone, and the commonest one and has the sexual immobility and the commonest cause of neonatal death, and the other is the 11-deoxycorticosterone, and which has got elevated elevated 11-deoxycorticosterone, and the 17-hydroxy has elevated 17-hydroxyprogesterone, and the third one is the 3-beta androgenase deficiency, which has got elevated dihydroepiandrosterone and androsterone, and so these need to be two ferrites has got um, androgen. This has got the true hermaphroditism has got and normal androgens and normal 17-hydroxyprogesterone. So gonadal biopsy is needed. Thank you very much for a patient's listening. Takeaways: pray, praise, trust, love Allah, and follow Rasulullah sallallahu alaihi wasallam. Our health and survival will come with. Thank you for the patient listening. Will come up with another review. Thank you very much.